Chief Medical Officer Sir Liam Donaldson is warning people not to panic after the first person in the UK without any previous health problems has died of swine flu. Sir Liam joins us now from Westminster. Sir Liam, I gather that this contraction was in Essex, dying in hospital on Friday. Was he just unlucky, or is there evidence perhaps that swine flu is now becoming more virulent or mutating in some way?
No, we're tracking the virus very carefully. There's no sign of any change in its character up until now. It could always happen, but it hasn't happened so far. What we're seeing here, I think, is the inevitability of a new flu virus, that eventually we will start to see a very small number of serious complications and even deaths in people who were previously healthy. Most of the serious complications so far have been in people who've had underlying illness of some sort. But it's worth making absolutely clear that with this virus, so far, we're seeing the majority of people having a relatively mild illness from which they recover quickly and make a good recovery.
However, is the concern that it is still with us in these summer months, and obviously you're looking to the autumn, the winter, for perhaps a potential rise in cases, and even though there are deaths with seasonal flu, we could still be facing quite a serious situation?
Well, yes, we will undoubtedly. The most likely thing in the autumn is that we'll see a surge of cases, with the disease going up to epidemic proportions in most parts of the country. If that happens, then a proportion of people will get complications, will be admitted to hospital, many of them will recover, but a proportion of them will die. And there will be risk groups, people with underlying illness, pregnant women, the very old, the very young, but amongst them will be a small proportion of people who were previously healthy and where a bad outcome wouldn't have been expected.
So what does the government do about this, bearing in mind what seems to have been the efficacy of Tamiflu, certainly in those previous cases, and I know there was work being done on perhaps a vaccination before the winter?
Yes. Well, we have taken a very precautionary approach so far, in that we've made Tamiflu available to everybody who has flu, not just the people who are in high-risk groups. We have enough supplies to be able to do that, and we'll continue to do that. Also, we'll be one of the first countries to get a vaccine. We'll get initial supplies in the early autumn, and then through the winter we'll eventually have enough to cover half of the population. But we won't be able to give it to everybody to begin with, so we're going to have to prioritise the vaccine to people who are in high-risk groups and healthcare workers, to make sure that the doctors and nurses are able to stay at their posts.
And maybe a few crossed fingers as well. So, Liam, for the moment, thank you very much indeed for joining us there at Westminster. Thank you.